Csaba, if I'm correct for the Georgian guest. Welcome everyone. I am honored to be here, and also in the name of Professor Dank and Dr. Balázs Máté, who are the leader of the Pharmacovigilance and Patient Safety Research Group from Semmelweis University. I have to say a small apology because, as Professor Liszkai said, that the young professionals should be overrepresented and be very active. At the moment, we are very minimal number, but we have an excuse that the exam period is just ongoing. So therefore, now the students, it's hard to recruit the students for such an event. So, but thank you, Said, for coming, and thank you for the participation. I have a bit long title, but it will connect to the previous topics, I think, closely. And I have this habit, which I inherited from one of my professors, that I always like to talk in historic aspects, and I also like the framed structure. So I would like to start from a quote from one of the classic person, from Hippocrates, that all disease begins in the gut. So this should be like the start of our journey. And in Hungary we also have a saying when we start to say some story that we are starting from Adam and Eve. So when we say a story which is very long and very detailed, that's what expression we use, that it will be a long story. So sorry for that, but this is the way how I feel if the presentation is full. And I will tell some fairy tale with a dragon, with some heroes, and with some adventure. So start with the fairy tale. I hope you can see it, but this is a world map. I should have changed a bit the contrast, but anyway you can see that there was a gentleman, our hero, let's say, then Butner, who with his colleagues studied the so-called blue zones. This is called blue zones because they're marked on the map with a blue pencil, and that's what name they gave it. And these places remark some exceptional places in the world where they observed especially long life. So they studied what could be the secret and what could be the special reason behind of these places. Why do these people has a long life, an exceptional long life comparing to the general population? It's one in California, one in Costa Rica, one in Italy, one in Greece, and one in Okinawa. However, I also know in Georgia, it's also especially in the Caucasian region, they also have this kind of like a micro blue zone. So they studied what could be the reason behind why these people has this long life, and that's hopefully what we can learn from them, how we should perform on our life to achieve such a result. So they collected 9 principles. So move naturally, have a purpose in life. You know, the Maslow pyramid is coming back. So the stress management is essential. Then we shouldn't make our stomach more than 80% full when we are having a meal. Plant-based diet is also very essential. Moderate wine consumption. However, they couldn't observe this in the California case, and also in the Okinawa case it was not present, but in the rest it was. The strong social community, family first, and the healthy society. Now from this I would like to highlight 2 points. The plant-based diet, and which I didn't mark with red, but it's also has such an important, the 80% full stomach. What we can learn, let's see, so regarding the eating, but first I want to show you a map. I like maps because they are so, you know, they are very visual. So this is a life expectancy at birth map from 2020, and on the map you can see that the darker the color, the life expectancy at birth is longer. And as you can see that Eastern Europe has a lighter color, which means that we have a not that good performance as the Northern and the Southern Europe, where especially you can see the dark color is presented. I know this is from 5 years ago, but we already have data from more recent, which is quite similar to this one, but to be honest, I didn't prefer that map which was provided for the new data, so I stick with the old one, so please I'm sorry for that, but I think this is more visual from the Eurostat. So here I would like to highlight the point that Northern Europe and Southern Europe has the best performance, and Western Europe, but as usual, and since we are in the Central and Eastern European Onco Academy, our life expectancy is not that good in this region. And some anomaly. One of the most important economic aspects when we analyze one country is the GDP, the gross domestic product, which shows, it's one of the way to analyze a country's economy. And I marked some, so these are the EU countries, and there is 2 columns. It starts from Norway and it ends with Bulgaria. And here we can see the total life expectancy at birth, or at least I can for sure see it, but if not, I will just summarize because I know that it's a bit small. Anyway, so the leader one is Norway, Switzerland, and Iceland with 83.1 life expectancy, and the GDP per capita is also like 60,000, which is extremely high. However, on this list, there are some interesting points. First one, the orange one, is the case of Netherlands and Greece, which has exactly the 81.4 years of life expectancy. However, the economy or the GDP value is just half or third. The Greek one is third what the Netherlands has, and similarly to Germany, where Germany is on par with Portugal. However, Portugal has half of the GDP per capita comparing to Germany, and hence it still has the same life expectancy. So there is some secret behind why these poorer but southern countries has a better performance. And also in the list there are some leading countries. So in the top 7, Spain and Cyprus is there, and they are more poorer than the rich northern and Western European countries. So let's say richness and developed health care is essential, but we should also consider that lifestyle has something to do there. And behind of this, since there was a gentleman called Mr. Ansel Keys, he was one of the pioneers of this so-called 7-country study, where they analyzed the different countries' population, and then they realized that there is an anomaly in the Southern European region, that in the non-infectious civilization and especially they observed this in cardiac diseases, that they had a better performance than the similar population in different countries. And behind of this anomaly, they find out that the reason could be that they have a specific lifestyle, the so-called Mediterranean diet. And this is just very quickly, because in oncology this is nowadays it's a very important and very key principle to follow. So we should have an intensive family life, a lot of movement, daily activity, sunlight, siesta is also important, big amount of vegetables and fruits consumption with nuts, and moderate amount of milk and meat products, and just a tiny amount of processed food and sweets and red meat and so on. So these regions has this specific lifestyle. And just to prove it, we also had an analysis which we did a historic analysis, if we can prove if this region is really doing that better. Because okay, we have the data since the 50s that they have a nice performance, but from the past we made a analysis based on European rulers, how long their life expectancy was, and then interestingly we find out that actually in southern, we made 4 different group or 4 regions in Europe, where we analyzed northern, southern, eastern, and the Western European rulers, and we find out that actually the southern rulers had a worst performance comparing the other 3 regions. This is the simplified results, and the orange line is the southern ones. Meanwhile, the others has an increase in the end. In the beginning, there is some anomaly. It's like the Northern Europe. It has some historics and some other reasons. I can maybe later discuss, but I don't want to spend too much time with this. Just what I want to show that in this study, because of some development issues and some malaria cases and some poisoning cases, we got the conclusion that living in the southern Europe itself, it's not enough to have a longer life performance. So if we not have the lifestyle, being there, just there, it's not enough. So what is the long story short, that if we follow the right lifestyle, even if we are not on that latitude or in that region, it can be still very beneficial for our lifestyle, for our longevity. But we have to face the reality that, of course, this sounds very nice, that, yes, I eat like a Mediterranean person, I drink a lot of olive oils, I have a lot of cheese and, of course, red wine. But we also like the hamburgers and the so-called Western diet as well. And now another gentleman, because as I told you, I like to be a bit dramatic. So from Feuerbach, the German philosopher, we are what we eat. So this is the average daily food intake values according to the FDA, and we can see that the biggest proportion, of course, are the carbohydrates, and the second is the fats, and the third is the added sugars on pair with the proteins. And interestingly, up until the 16th century, diet was let's say, the first and main therapeutic tool in medicine. And if we consider it, it's so since Paracelsus, who is our next gentleman, who said the dose makes the poison, and since from him we count the iatrochemistry in the medicine, and we can say that we take some more specialized chemical compounds for disease and for cures. So before Paracelsus, from the ancient times, diet was the primary tool for if there was any disease, like diet was one of the main tool what doctors touched or changed in a patient's life. And if I put it to a different angle, actually diet or food is also like, if medicine is like a single molecule, put it into the matrix with some materials, so like when we have a tablet, it has a one or two or more compound with a matrix which keeps it and brings to a specific to a specific place to interact in the body and to have some effect. But in general, we can also consider like food is like a polymedicine, because it has a big amount of different molecules in a complex matrix. So it's not a, let's say, a bad idea or a bad aspect to consider that diet is actually like a complex way of a bunch of medicine, of course in a more natural way and in a different form. But I just want to say that diet itself can be really essential thing. And as Professor Ferrari touched this topic, that there is this NOVA classification, which is classifying food to 4 different groups, and I will just introduce them quickly. So one is the unprocessed, minimally processed food. These are those kind of food which we basically go to the nature and touch it. So like, let's say, apples, fresh fruit, vegetables, eggs, milk, which we directly have an access and we can really recognize what it was originally. Then the second group is they are still very natural but extracted already, like salt, butter, vegetable oils, and we use it for seasoning and for cooking. The third one is now a bit more complex, like these are altered already with sugar, salt or oil, but still we can keep the basic identity of that food. And the example for this is the canned vegetables, cheese, freshly baked bread, and smoked meat. And the fourth one is nowadays the demonized, ultra-processed food, which is the substances which has low, so no whole food present there. It has rich in additives, colorings, artificial flavors, and examples are soft drinks, instant noodles, packaged snacks, sugary cereals, and so on. And on the picture, so basically the core part of the Western diet. But I would like to highlight that this classification is not that strict, so it's more like a spectrum than a strict category, because in some cases it's very hard to tell if that food, okay, this is clearly ultra-processed or this is clearly like a natural one. So it's more like a perspective how to perceive the food. So the UPF characteristics is the industrial formulations, high in added sugar, salt and fats, contains emulsifiers and low in fiber and essential nutrients, have a usually high glycemic index, and the food matrix is usually not natural. They are very accessible, so it's in social economically it's important that they are highly accessible and affordable. And since we are getting more lazy and we want to save also more time, it's very fashionable also to, or let's say it's an easy solution to consume this kind of products. Among the low-income population it's higher, and education and food literacy has also connection with the consumption. And the highest consumption we can observe it in the Western countries and the lowest one in the developing countries. But the trends are rising in these countries as well, and the urbanization and the marketing has a key role in it. So back to the dose makes the poison. So I just bring the table like what is the share of an adult's diet in different countries. So you can see that the US 58% is leading, with the UK on par. Sweden and Australia is like up to 40%, which is quite high. I was also checking for Russia. They didn't have clear data, but they estimate around 27, so like around the average European percentage. Italy is like 18, 20. Hungary is between 10 and 20. It's not clear. And why I was asking, because in Georgia I couldn't find clear data. They tend to estimate it somewhere between the 10 and 27, but probably it's something lower, because as I mentioned, that the more easter we go, the consumption is yet lower, but it's increasing. And yes, so there is a strong association with the UPF consumption with the obesity and metabolic disorders, the cardiovascular disorders, and cancer risk. And this brings a global burden, and we should focus also on the prevention, because the leading causes of diet-related mortality and cardiovascular diseases and cancer and type 2 diabetes, it has a strong connection, and the UPF consumption brings a risk factor. Behind of this, the mechanism could be the chronic inflammation, the gut microbiota disruption, the endocrine disruptions, and the carcinogenic additional materials in the food, and also the excessive energy intake and the obesity can be also important in this matter. And regarding the cancer patients, it's also after the diagnosis, usually they have a change because they want to change their life, and they start usually strong lifestyle changes. So post-diagnosis change happens usually, and they have a reduced appetite, as we have discussed before, that because of the cachexia and because of the treatment they have worst conditions. And there is also consideration between the therapeutic nutrition and the convenience foods. I also would like to highlight one interesting part, that so we consider that these ultra-processed food are demons, and but we should also consider that there is this oral nutritional supplements. So in extreme cases, or sooner or later, it's usually that happens that we support the patient's diet with these oral nutritional supplements, which supports and which is a very smart and packed way to bring the necessary nutrition. But in some way, these are also ultra-processed food, because they are prepared and designed for that. And it's beneficial for the cachexia and for the malnutrition, which later supports the treatment. And I bring here just the clash, that so there are some good and bad parts. So we can consider it's a good part that these oral nutritional drinks can support the patients. But there are also the other part, which is like let's say the Western diets, classical foods. Also in the clinic, I can observe that many patients still, like for breakfast, they just eat cookies, and for the lunch they eat something purely carbohydrate. So, but they also take the Nutri drink. So, I just want to highlight it that ultra-processed food, if we consider in this way, they are not purely evil. And yes, just some details that yes, for malnutrition, weight loss, easy to digest, accessible, and it's fortified with a lot of nutrients. So we should also find a balance in this matter. And yes, so we can classify there are some harmful UPS, neutral ones, and the therapeutic UPS, the oral nutritional supplements as I mentioned, which are in some cases saving or supporting the therapy, which is essential. And the importance of nutritional guidance and the ongoing monitoring, just to relate to the previous presentations, that so this can increase the quality of life, the treatment efficacy, because if the patient has better condition, of course the treatment can be more successful if the general condition are better. So nutri-drinks can support that and also help the malnutrition. And also it's a difficulty that the lifestyle and the social status is changing, so especially in some poorer case of patients, it's more challenging to have a, let's say if the patient wants to follow the Mediterranean diet, it's more challenging if they have a lower income. So as Professor Dunks usually says that in this case, it's if we can just achieve that at least they change the normal pig fat to duck fat. It's a small change, of course it's not solving the problem, but on their level it's already something, a small change, and maybe sometimes it's already appreciable if we can at least achieve this in some case of patients. And of course the recommendation is to have regular follow-up and counseling with the nutritionists in the clinic, in our clinic. As I forget to mention that I work in the oncology clinic in Semmelweis University along with Dr. Balázs. I'm a clinical trial manager, and we have for the patients it's possible to go for regular nutritional checkups and discussions. And on this actually we had done a pilot study in the department just with some talented students with Koncos Julia, with Kovalik Bálint and Sedlacek Anna. We just gave a quick questionnaire and a quick evaluation on these patients. With 25 oncology patients, we checked their nutritional counseling follow-ups and results and how their condition changed during the time, and we can say that in these cases the UPF consumption was lower, they had appropriate BME levels, and the overall nutritional value increased, which was, of course, it should have done in a higher number of patients, but with this small pilot, with this 25 patients, we could see that actually the nutritional counseling is very important and essential, because most of these patients had a increased condition after regular dietetic counseling. And it's also important because it's personal, and of course we need to enroll more patients with this study, but the essential part is that it's essential and important for the patient, and that's why we should promote and make some policy implications with this. Not just oncology patients, but even regular people should care more about their food consumption, and for that promoting the nutritionists' work could be essential. So as Professor Rama mentioned, that in the future this could be very important. Also, I want to just mention some countries where they try to make some policies, and why I put here the Norwegian flag, because, for example, in Norway, they made a change in the system that they put tax on alcohol and high sugar and, let's say, on unhealthy product, they made some taxes. So interestingly, when the person is poorer in Norway, they are forced to eat more healthy because more healthy products are cheaper. So the luxury of the rich people is there to drink alcohol and eat extensive amount of chocolate. Also similar approaches happened not just in Norway but also in the United Kingdom, in France. Even in Hungary we had a few years ago they started the so-called chips tax. So they put some tax on chips to increase the price, so they wanted to change the habit a bit, or at least influence the people that it's not more expensive. As I can see in my environment, of course, because we are always exceptions, so I'm not talking about myself, but as I can see that it didn't change the consumption regarding these unhealthy products, but at least there is some intention to do it. Recently now they changed the energy drink, now they changed on a government level the caffeine value in the energy drinks to protect more the younger generations, because it's very popular to drink nowadays for the young generation energy drinks. On my cousin example, he's 12 years old and he already drinks 2-3 bottles of Monster every day. I'm not his father, but it's not a good tendency, so there should be some changes made, and that's why it would be important to also for the WHO and some regulatory changes to apply. And for the end, this is the so-called smart plate or okos tányér. This is made by the Hungarian Dietetic Association, of course based on the International Food Scientific Committee. Also the Harvard has a very similar solution. So with this is like more like a guidance to train the people, like when we see the plate what we eat, that it should be like more than 50% should be the food based on vegetables and fruits. 1/4 should be grains, and the rest could be meat, fish, eggs, and so that should be the proportion in general when we eat, because with this approach it's probably it's more easier for the people to understand what is good and what should be the balanced proportion for the food. So to promoting this not just for the patient but for the general population should be also a big improvement. And the final reflections is that UPF has a complex role in cancer care. We should find a balance between the consumption and the risk reduction, and of course, as always, we need a multidisciplinary approach. And as I told you, that I like always the historic persons and the frame structure, so I want to close with Aristotle's that we should always follow the golden middle way. So thank you for your attention.